Okay, good afternoon. So today we are going to deal with the muscular system, the gross anatomy of muscles of the body. We have dealt last time with the histology of muscles, and today we are going to deal with the gross anatomy of the muscular system. This lecture is related to two videos, virtual anatomy lab videos, one on the muscles of the upper limb and the other is on the muscles of the lower limb. Okay, and there are self-assessment PowerPoint files as well, one for the upper limb and the muscles of the trunk, and the other is for the lower limb, including surface anatomy. So to start with, this is a point to be mentioned about attachment and origin and insertion of muscles. When muscles contract, they shorten, and when they shorten, they pull on the bones. So the muscles, they do not push the bones, but they pull on the bones, and they have, usually the muscles, they have two attachments. And as I said, muscles are attached to bone or to, skeleton, whether bone or cartilage, but some of the muscles are attached to the skin, but most of the muscles are attached between bones or between bones and cartilages. So one of the attachment of muscles is usually the least movable or more stationary. Like, for example, here, when the biceps muscle contracts to flex the elbow joint as such, so this origin of the muscle, this attachment of the muscle is not moving. So that's why it's called the origin, or it's called the proximal attachment. And the other muscle, the other attachment, which is attached to the radius, as we are going to see in a moment, is the one that is moving, and that's how it is going to move the forearm, because the radius is one of the bones of the forearm. So this is called the insertion. So the insertion is the more movable attachment of the muscle. However, nowadays in many textbooks, they are using the term attachment rather than origin and insertion. And the reason for that is that some of the muscles, not all the muscles, but some of the muscles, they can act either way. In other words, for example, let's say we have this muscle, which we are going to study in a moment, which is called the latissimus dorsi muscle. This muscle is attached to the back, to the trunk, the back, and on one side. So it's attached here to the trunk and back, and here it's attached to the humerus. And when it contracts, usually it moves the upper limb. It contracts, it moves the humerus at the shoulder joint. So that will be, the first one will be, here will be the origin of the muscle, and this will be the insertion of the muscle. But suppose that you are holding a bar, like a monkey bar. In that case, you are fixing the insertion of the muscle. And so the muscle is going to work the other way around. It's going to work from what is called its origin. That's how it's going to elevate the trunk. That's why it's called the climber's muscle as well. As well as acting on the humerus, it can act on the trunk and elevate the trunk if the humerus is fixed. So that's why we're not usually using origin and insertion. Rather than that, we use attachment is better because the muscle can work on either side. Remember last time when we dealt with the muscles, we said that the muscle fibers are arranged in fascicles. So these fascicles will give certain shape to the muscle. So they have certain arrangements in different muscles. Sometimes we have parallel fascicles, like for example, this muscle here, we have parallel fascicles in the biceps, almost parallel, but they constitute a fusiform shape. But in another muscle, which I'm going to talk about in a moment, is completely parallel fibers. It's called sartorius muscle. So it could be completely parallel, longitudinal axis of muscle, to the longitudinal axis of muscle, or it could be fusiform, as I said here, like in the biceps, nearly parallel. They could be circular. Usually they are around an opening, like the mouth, the anus, the orbit. So it's called, like for example, this muscle is called the orbicularis oris muscle. Or it could be triangular. It has a wide origin, as you can see here, for the pectoralis major, and a narrow insertion on the humerus. So it is triangular muscle, or it could be pinnate, like a feather. So it could be like half a feather. We have the tendon on, this is the tendon, and then the fascicles are very short muscle fibers. So they could be either on one side of the tendon, and this is called unipinnate muscle, or they could be on either side of the tendon, and this is called a bipinnate muscle. Okay, so unipinnate, bipinnate, and some of the muscles, they have groups of bipinnate fibers like this. So these are groups of bipinnate fibers, and these muscles are called multipinnate. So that's the difference between unipinnate, it's the fascicles on one side of the tendon, bipinnate, fascicles on both sides of the tendon, and the multipinnate, we have multiple bipinnate fascicles. Muscles have different ways to contract, either reflexly, like for example here in this picture, there is a tapping on the tendon, of course using a hammer. We say a hammer, but this is a neurological hammer. It's a special hammer. So tapping on the tendon with neurological hammer will result in reflex contraction of the muscle. We're going to talk about this when we deal with the nervous system. So this is a reflex contraction. There's reflex contraction of the muscles of respiration, for example. And there is a tonic contraction. The type of contraction that I mentioned last time, I mentioned that muscles have a certain tone, especially the muscles that maintain the posture. Or I mentioned an example that the muscles that maintain your gaze or your head in horizontal gaze. Otherwise, if you sleep while you are sitting, then your head will fall down. So there is a tonic contraction of muscle. And there is another type of contraction, which is called the phasic contraction. This is either isotonic, which is most of the muscles when they contract, they produce a movement. That's called isotonic contraction. Like, for example, now contraction of biceps causing flexion of the elbow. And this could be either concentric or eccentric. I will talk about this in a moment. And sometimes the muscles contract, but there is no movement. Like when you are clenching for teeth, for example, the muscles of mastication are contracting, but there's no movement. There's force produced, but there's no movement produced. So this is called isometric contraction. Let's go back again to talk about the isotonic contraction. I said during isotonic contraction movement is produced. This could be either concentric or eccentric movement. So for example here, elevating the book is a concentric movement. Now, putting the book down here requires relaxation of biceps muscle, but it's not complete relaxation. The muscle gradually gives way as it relaxes. So that is eccentric. So it's contracting at that time, but it is at the same time, it is relaxing, but in a gradual, programmed manner. This is called eccentric contraction. Otherwise, the movement will be clumsy by the effect of gravity, for example. But if you want a smooth movement to take place, of the movement of putting the book down, then you need to contract the muscle and relax it gradually, and this is called the eccentric contraction. Types of muscle action. Most of the time when we talk about muscles, we just think like it's only one muscle and two bones, and then when the muscle contracts, it will move these two bones. It's not like that. I mean, we are not like marionettes and ropes and pieces of wood. It's not like that. There are groups of muscles, they work together. The muscle that is produced is not the result of contraction of a single muscle, but a contraction of a group of muscles. Each one of these muscles has a different mode or type of muscle action, but we usually refer to a muscle as an agonist muscle, which is the main, or a prime mover, which is the main movement that is produced by that muscle. Like when we say, for example, the biceps muscle, it is a flexor of the elbow joint. But at the same time, we need the action of another muscle which opposes this movement to work as eccentrically working, and that is the triceps muscle. But the triceps muscle is an antagonist. When it comes to the triceps muscle, and we talk about its action as a prime mover, it is an extensor of the elbow joint. But this does not mean that the extensor is not working at the time of flexion. It is working, but not as a prime mover, as an antagonist. And this does not mean that it is only these two muscles are working in this movement. There are other muscles like for example called fixators. They fix the proximal part of the limb. For example, there are muscles holding the scapula so that to make the movements in the distal part of the limb possible. So fixators, usually they stabilize the proximal part of the limb. And there is another group of muscles which are called synergists. Not in all movements, but some movements, they require synergistic action. That's to say, these synergistic muscles, they prevent unwanted movements. They prevent the unwanted movement. An example is given here, like for example in cops and robbers movies. Usually in order to fight the attacker who is holding a knife or a dagger, holding it in the hand, in order to have a powerful fist, as you might notice that if you hold your pen or pencil now, in order to produce a powerful fist, you will also require contraction of extensors of the forearm as well as the flexors. Because if it's only the flexors that are contracting, then it will cause flexion of all these joints, including the wrist joint, and the muscle cannot shorten indefinitely. So therefore, the contraction of the muscle in this case, if it is also acting on the wrist joint, will be very weak on the distal joints of the hand, and so the grip will be weak. But if we are going to use the extensors in order to prevent this unwanted flexion, then the flexors will make a firm grip in that case. So that's why, in order to avoid the attacker in this case, you try to bend his or her wrists, and this will make the grip weaker in that case. So in this movement, the extensor muscles, although it's the main movement is a movement of flexion, but the extensor muscles are working as synergists for the prime movers who are the flexors. Okay, so that's the synergistic action. So the muscles, they work together. Don't expect the body as I said, like a marionette. It's not like that. How do we name the muscles? Different ways of naming the muscles. There's no fixed way. So either, for example, direction of muscle fibers. We have this muscle here, which is called rectus abdominis. Rectus means straight. So it's a straight muscle of the abdomen. Or the muscle which is close to it has muscle fibers which are oblique. So it's called external oblique. And then, so it's the direction of muscle fibers. Size of the muscle. For example, we have in the buttock a gluteus maximus, big, very big muscle. There's a medius and there's a minimus. So the size of the muscle. The shape of the muscle. You are all familiar with the deltoid muscle here at the shoulder. It's triangular, looks like the Greek letter delta. So that's why it's called the deltoid muscle. There's another muscle which is called quadratus femoris on the back of the femur because it is quadriangular in shape. So it's called the quadratus femoris muscle. The action of the muscle. So we have, for example, supinator muscle. We have a pronator muscle. We have an adductor muscle. Okay, so it adds to the name of the muscle. Sometimes a combination, like adductor, longest. The muscle action and size. It's long. Number of origins, like the biceps, triceps, means 3 heads. We have another muscle in the front of the quad, we call it. It's the quadriceps, not quadratus. Quadratus indicates the quadriangular shape of the muscle, but this muscle has 4 heads, so it's called the quadriceps femoris. Location, for example, a muscle of mastication. As you clench your teeth, feel the temporal region, you'll feel a muscle contracting here. That is temporalis muscle because it is in the temporal region, or pectoralis because it is in the pectoral region. Or we can use the origin and insertion of the muscle. For example, we have a muscle which is called coracobrachialis. I think I mentioned that muscle before. From the coracoid process of the scapula to the bone of the brachium, the humerus. So it's coracobrachialis, or this muscle which is mentioned here. Very long name, but it's very useful to remember the origin and insertion of the muscle. Sternocleidomastoid. It's attached to the sternum, sterno, cleido, clavicle, and then goes back to the mastoid process. So it's sternocleidomastoid muscle. So there's no single way of naming the muscles. As I said, the muscles, they work in groups. They don't work as single muscles, they work in groups. And sometimes the groups, they have the same origin or the same nerve supply or the same function, like flexor muscles of the forearm. Most of these muscles, the flexor compartment of the forearm, they are attached to the medial epicondyle of the humerus. Extensor muscles of the forearm, most of them, they are attached to the lateral epicondyle of the humerus. So when there's one condition when their origin, that common origin at the lateral epicondyle is inflamed, it results in what we call tennis elbow, if you have heard of that term. Or the flexor muscles, when their common origin is inflamed, it results in a condition which is called a golfer's elbow. Again, if you have heard of that term before, and probably many of you will hear of that term later on. So because they have a common origin, they have a common nerve supply, and they have a common action. Muscles of facial expression, or the muscles that move the skin of the face, they are all supplied by the facial nerve. While the muscles of mastication, the muscles that we use them to move the temporomandibular joint, they are all supplied by the trigeminal nerve. Let's start with the muscles of facial expression. These muscles, they are attached from one side to bone, and from the other side, they are attached to the skin. That's why they move the skin and produce the wrinkles and produce the expressions that we use in our everyday life. So we have one muscle here, which is called frontalis. This one is called frontalis, and this is responsible for the horizontal wrinkles on the forehead. Then we have the orbicularis oculi muscle. So this one's called orbicularis oris because it's around the mouth, so it is oris. And this one's called orbicularis oculi, and this closes the eye. It's the muscle of winking. It closes the eye, and at the same time, it is responsible for these skin creases or wrinkles on the lateral side of the eye, which are called the crow's feet wrinkles. Orbicularis oris is the kissing muscle because it puckers the lips. We have other muscles attached to the zygomatic bone. Remember, the bone of the cheek. So we have zygomaticus major and zygomaticus minor. They pull the lateral side of the mouth laterally, and so they are called smiling muscles, or you are used for smiling. And then we have another muscle. Unfortunately, we don't have it clearly here, but this is the muscle. It is the muscle of the cheek. It has horizontal muscle fibers, and it's the muscle of the cheek. If you press the inside of the cheek with the tip of your tongue, then that is the buccinator muscle here. Okay, and also it's called the trumpeter's muscle because it is used for blowing, it's used for sucking, and it's also, for everyday use, it's not for blowing, and for everyday use, we can use it for actually when you are eating and chewing, it pushes the food which is present in the vestibule of the mouth, that's to say outside the teeth. It will push that food toward the teeth in order to be masticated. Okay, so these are the muscles of facial expression. And then we have a muscle here in the face, not only muscles of facial expression, but there are muscles that can move the mandible, as I mentioned, and they are called muscles of mastication. They move the mandible. So all of them are attached to the mandible. We have examples here. We have masseter. This is the masseter muscle here. It elevates the mandible. And there are another muscle, which I just mentioned, the temporalis muscle, which is present on the temple. And it's, as you can see it here, it's attached to the mandible as well. So this one elevates the mandible. Again, it elevates the mandible, but at the same time, it has fibers here, posterior fibers, which are almost horizontal. So when they contract, they pull the mandible backwards. And this movement is called retraction of the mandible, okay? While, as you can see here, for example, the masseter muscle, its fibers are directed downwards and backwards, so they can, not only they elevate the mandible, but they can protract the mandible. Remember these movements, protraction, retraction, which we use them for the mandible and for the scapula. Now this is the sternocleidomastoid I just mentioned. It's a muscle of the neck, and you can see the origin. It has a sternal head, it has a clavicular head, and it's attached to the mastoid process. And then if you just imagine the attachment of the muscle, you can predict the action of the muscle. So if the muscle on one side is going to work, then it's going to flex the neck on one side, and at the same time it's going to rotate the chin to the other side, okay? As if looking under a table. That's the action of the muscle, as if looking under the table. It rotates the chin to the contralateral side, not to the same side, but to the contralateral side, and flexes the neck to the same side of the muscle. Muscles used for breathing. We have muscles in between the ribs, and definitely you have seen these muscles, you have eaten these muscles when you order ribs, and these are called intercostal muscles because they are present in between the ribs. Some of them, like external intercostals, they elevate the ribs. Others depress the ribs, like internal intercostal muscles. But these muscles are not the main muscles of breathing. The main muscle of breathing is the diaphragm. So this is the diaphragm. It is dome-shaped. It has actually two domes. And as you can see that it has multiple muscle fibers on the periphery, and there is a central tendon in the middle. So when these muscle fibers contract at the periphery, they will pull down on the tendon, the central tendon, pull it down, and this will increase the dimensions of the thoracic cavity because the thoracic cavity elongates. The height, it elongates, and this means, in physics, it means negative pressure. Negative pressure means that it's going to suck the air in, keeping in mind that the respiratory passages are always open, they are patent, because of the presence of cartilages in their wall. So when there is a negative pressure, this will suck the air in during inspiration. During expiration, it is not necessarily all the time that we contract, there's no need for a muscle contraction in quiet respiration, like the way that you are doing now. You are sitting, you're not running or moving upstairs or whatever, but in that case, the muscle relaxes and there will be recoil of the elastic fibers on the wall of the lung. Remember the elastic connective tissue? It stretches during inspiration and then recoils back during expiration. Also, we have abdominal muscles. Those abdominal muscles, they protect abdominal viscera. They increase intra-abdominal pressure, like for example, during defecation, urination. We need to increase intra-abdominal pressure, sometimes also during coughing or sneezing. And they protect abdominal viscera, and also they move the trunk. So that's the function of them. We have one of them, or a couple of them, a pair of them, on either side of the midline. Muscle fibers are straight, and so it is rectus abdominis muscle. This muscle is probably unique that it has some fibrous tissue in between the muscle fibers, dense like tendons. So they call them tendinous intersections, and that's why they give the appearance that muscular and thin subjects, they give rise to the six-pack abdomen because of the presence of these tendinous intersections in between the muscle fibers. And then we have other muscles on the side, like this one, is oblique muscle fibers. It's called external oblique. And then there's another one deeper to it is internal oblique. You can see them here. This is a horizontal section, transverse section, showing you on the side there are three layers of muscle fibers. Deep to the skin and subcutaneous tissue, there is the external oblique, then internal oblique, and then transversus abdominis. And this reflects the direction of muscle fibers. Like the direction of external oblique muscle fiber is this way, downwards and forwards. The direction of external oblique is downwards and upwards. You don't need to go into these details. I'm just describing the names. And then the transversus abdominis muscle, as the name indicates, its muscle fibers are directed horizontally. That's why it's called the transversus abdominis. But you need to know the sequence You don't need to know the direction of muscle fibers, but you need to know the sequence. External oblique, internal oblique, transversus, abdominis, going from superficial to deep. And of course, there is skin and subcutaneous tissue. The rectus abdominis is close to the midline. That's the midline here, and they are close to the midline. There's only one muscle here, no group, not a layer of muscles like on the lateral side of the abdomen. On the back, most of these muscles on the back, they move the vertebrae. They are the actual muscles of the back, we call them. They are anti-gravity muscles, and they maintain the posture. These muscles, they have very complicated. We don't need to go into details. Just keep in mind they are also called erector spinae muscle because they straighten the vertebral column. They straighten the spine. They work as anti-gravity muscle. And being so, therefore, if you remember last lecture, we were dealing with types of muscle fibers. They are of the red type of muscle fibers, the slow muscle fibers, the ones that have a lot of myoglobin and use oxidative way. Okay, so those are the muscles. In fact, these are the muscles that you eat when you order a ribeye or a sirloin steak. That's why if you don't have it well cooked, then you will find that in the center it is juicy. There's red fluid in the center. This is not actually, this is not blood. This is the myoglobin, the excess myoglobin that these muscles have because they are red muscle fibers. Now let's move to the muscles that work on the limbs, and let's deal with the muscles that stabilize the pectoral girdle, like the trapezius muscle. This is the trapezius muscle. You can see it here. It is dotted. Actually, one muscle is a triangle, but if you have two muscles on either side, then that will create a trapezium. So that's why it's called the trapezius muscle. It's a wide muscle, partly attached to the skull, and that's why it can extend the neck, and partly it's attached to the scapula as well, the scapula and the clavicle. Okay, so it's attached to the spine of the scapula, to the acromion process, and to the clavicle. It has muscle fibers in different directions, and that's why it has multiple functions. So the upper fibers, these fibers, the upper fibers, they can elevate the shoulder, as well as extending the neck. They can elevate the shoulders, like elevation of the shoulder, showing uncertainty, for example. And the middle fibers, the fibers that are present here, are almost horizontal, so they can approximate the scapulae in a movement which is called retraction of the scapula. Probably I mentioned this when we were dealing with the movements at the joints. And then we have the lower fibers which depress the scapula. But the important thing to remember about this muscle is that if the upper fibers and the lower fibers work together, they will produce what's called a couple. And this will result in rotation of the scapula. Rotate the scapula so that the glenoid cavity looks upwards. And this is important during abduction. Abduction, the main muscle of abduction, as we will notice in a moment, is that deltoid muscle that you have. But the deltoid can only abduct your arm at the shoulder to the level of 90 degrees. After 90 degrees, and you can notice that on your partner or your colleague, you can notice that if after 90 degrees, you will find that the scapula should rotate. And this rotation of the scapula is provided partially by this muscle. When its upper fibers and lower fibers, they work together at the same time. Here's another muscle, serratus anterior. And the name of the muscle indicates its shape. It is serrated, like sawtooth. Okay, so that's why it is serratus anterior muscle. And it's attached, as you can see, to the side of the ribs on one side. On the other side, it's attached to the scapula, the medial border of the scapula. Deep, not here, but it is deep into the medial border of the scapula. And this muscle can again rotate the scapula together with trapezius so that to achieve abduction above 90 degrees of the shoulder. But more important than that is that this muscle can pull the scapula forwards on the thoracic wall. This is a movement called protraction of the scapula, and it's, for example, required for delivering a straight punch like that. That's why it's called the boxer's muscle. So serratus anterior is the boxer's muscle because it protracts the scapula. Opposite to protraction is retraction of the scapula. One muscle that can retract the scapula are the middle fibers of trapezius. The other muscle here in the pectoral region is pectoralis major muscle. This is an example of a triangular shaped muscle. It has a very wide origin from the clavicle, from the costal cartilages. It's inserted into the humerus, proximal end of the humerus. If you know the origin and insertion of the muscle, you can predict the action of the muscle. This muscle adducts the shoulder, adducts the humerus at the shoulder, medially rotates, and these fibers, the clavicular fibers here, these fibers in specific, they flex the humerus at the shoulder joint. The clavicular fibers, they flex the humerus. The other muscle which was mentioned in the introduction of this lecture is the latissimus dorsi muscle. This is the actual latissimus dorsi muscle. By the way, one point I would like to mention about pectoralis major, which is probably, you will find it in the surface anatomy, is that this lateral border of the muscle, you can feel it in front, and it forms what we call the anterior axillary fold. There are two folds at the armpits. One of them is anterior axillary fold, and the other is the posterior axillary fold. The posterior axillary fold is produced partially by the fibers of latissimus dorsi muscle, this muscle. Again, latissimus means very wide. The name of the muscle means the wide muscle of the back, latissimus dorsi muscle. So it's the very wide muscle of the back, and as you can see, it's attached to multiple vertebrae and to the iliac crest here, and then becomes narrow and will be attached to the proximal end of the humerus. From the attachment of the muscle, you can predict its action, but probably this diagram might help you remember the action of this muscle here. This diagram is as if you use this muscle. Actually, you don't use it, but in order to summarize the actions of this muscle, is as if you are scratching your opposite scapula. Okay, you scratch your opposite scapula. So you are adducting, extending, and medial rotate the humerus in order to reach the opposite scapula for scratching. These three movements are produced by the muscle. Okay, not necessarily all of them together, but if we combine them together, it is as if we are scratching our opposite scapula. The other thing we should remember about this muscle and many other muscles is that if the humerus is fixed, then it can elevate the trunk. Okay? Same thing is true, for example, here for pectoralis major. If the humerus is fixed, then it can elevate the trunk because it's attached to the costal cartilages and to the sternum. And in fact, this muscle is used as an accessory muscle of respiration. If sometimes you need to move the ribs fiercely in order to have more air, if you are short of breath, what you are going to do? You are not conscious of that, but in that case, you are fixing your humerus in order that pectoralis major will work the other way around on your ribs and elevate your ribs. The other muscle is the deltoid, and this muscle, it's attached to the clavicle, it's attached to the acromion and the spine of the scapula, has many fibers, has anterior fibers, and they can flex and medially rotate. It has posterior fibers, they can extend and laterally rotate, and has the middle fibers, which are the main abductors of the shoulder, but up to 90 degrees abduction of the shoulder. And we are always using this muscle when we are walking. They are used alternatively. The anterior fibers, they flex, the posterior fibers, they extend. Okay, so not only the middle fibers are important, but the anterior and posterior fibers are usually used alternately while moving. We have a group of muscles that were mentioned when we dealt with the bones of the pectoral girdle, and these are the rotator cuff muscles. They are small muscles, supraspinatus, infraspinatus, subscapularis, and teres minor. They form a cuff around the shoulder joint, and I mentioned that they are important for the stability of the shoulder joint. Biceps muscle, biceps brachii, as the name indicates, has two heads. So it has a long head, which is attached to the scapula and called in an area called supraglenoid tubercle. These details, you will find them clearly in the video, okay? I just included them in the lecture, but you can write some notes from the video because Dr. Allen is going to show that to you. Where's the supraglenoid tubercle? Where's the coracoid process? And he will mention that look at the short head of biceps and look at the long head of biceps. So that is the short head of biceps attached to the coracoid process, and then the muscle distally, it's attached to the tuberosity of the radius. Because it's attached to the radius, then it can move the radius. Either move it in flexion of the elbow, or there's another movement of the radius, remember, supination. So it's a powerful supinator, because in supination, it is the radius that moves around the ulna. Muscles that are attached to the ulna will not be able to rotate the forearm in supination, because we need a muscle that moves the radius in supination. The other muscles in the flexor compartment of the arm is the coracobrachialis. I mentioned about the coracobrachialis. I said it's the name of the muscle indicates its attachment. And then we have another muscle which is called brachialis. Deep to biceps is called brachialis. And this one is attached to the ulna, not to the radius. So it only flexes the elbow. It doesn't rotate, it doesn't cause supination or pronation. The opponent of the biceps brachii is the triceps brachii, the muscle with three heads. And the muscle is attached to the scapula. It's attached to the humerus by two heads. The other one is deep, is not shown here. And on the other hand, it's attached to the olecranon of the ulna. So it can act as an extensor of the elbow and extensor of the shoulder joint. The other muscle here is called brachioradialis. I'm just concentrating on this muscle as an example of a muscle of the forearm. The name brachio means it's attached to the humerus on one side. Radialis, it's attached to the radius. Okay, and this is the muscle or the prominent muscle that you just put your coat on. So that's the brachioradialis muscle. You can see it here in the dissection video. This muscle is important in flexing the forearm. It doesn't act on the wrists because it doesn't cross the wrist joint. So it only acts on the elbow, and also can act both as a pronator and supinator depending on the angle of the forearm. In the hand, we have very small muscles on the hand called intrinsic muscles, like this one. These muscles, the thenar, the hypothenar muscles, they are important for the skillful movements of the fingers, like in playing music or in knitting and drawing and writing. They are called intrinsic muscles. Apart from these tendons of these powerful muscles that are present in the forearm, we have small muscles that are for the skillful movements. Regarding the lower limb, we have in the gluteal region, that big muscle, I mentioned the name before, the gluteus maximus muscle. And this muscle is attached to the ilium, it's attached to the sacrum on one side. On the other side, it's attached to the greater trochanter of the femur, okay? And part of the muscle, this is also important, is attached to a very long tendon, which is thickening of fascia, very famous, called the iliotibial tract, because it extends from the ilium to the tibia. So the muscle, in addition to acting as a main extensor of the hip, it also acts on the knee joint, stabilizes the knee joint. Actually, for the hip, the main extensors are the muscles of the hamstring compartment, the compartment of the back of the thigh. But in extremes of extension, in powerful extension, we need the gluteus maximus. So now, as you are leaving the lecture and you are standing up, in fact, this attaining the standing after the sitting position, you are going to require a very powerful extensor of your hip, and that is the gluteus maximus. So feel your gluteus maximus as you are standing up. And that's why, remember the bent position attained by sprinters as well? It is to elongate the muscle so that when it contracts, the sprinter can run fast. Then we have deep to it are gluteus medius and minimus muscle. These are small muscles here. You will find them in the video. And then there are flexor muscles. We have two of them. One of them is called the iliacus because it's attached to the ilium, the inside of the ilium. And the other one is called the psoas muscle with P. There's P here. So the psoas is attached to the vertebrae, and then its tendon fuses with the tendon of the iliacus, and that's why the muscles together are considered, sometimes they consider them as a single name called iliopsoas, and it's attached to the lesser trochanter of the femur. This is a powerful flexor of the hip joint, powerful flexor of the hip joint. The other group of muscles are the adductor muscles of the thigh, and they form the medial compartment of the thigh. They are the group of muscles that you can hold them between your thumb and other fingers. They originate from the pubis. Remember, the hip bone consists of the ilium, ischium, and the pubis. So these muscles, they arise from the pubis part of the hip bone. The muscles, they carry the name adductors, which indicates their function as well as their size. So we have adductor longus, we have the adductor brevis, and we have the adductor magnus. There's also another muscle which can be added to the adductor group. This is called the gracilis muscle, and as the name indicates, in Latin means the slender muscle. This is not only a slender muscle, the gracilis muscle here, but also the only member of this compartment that is attached to the tibia. That's to say, it can also act on the knee joint. But the other members, the adductor, longus, brevis, and magnus, they are attached to the femur and they do not act on the knee joint. They only act on the hip joint. They are adductors of the hip. In the anterior compartment at the front of the thigh, the big muscle here is called the quadriceps femoris muscle. And this means that it has four heads. The four heads are, first one is called rectus femoris muscle, and this is the only head, the only member of this muscle that is attached to the ilium, while the other three members, which carry the name of vastus, vastus lateralis, vastus medialis, and vastus intermedius, they are attached to the femur. Then the four heads, as the name of the muscle indicates, quadriceps, the four heads, they form a tendon, the quadriceps tendon, you can see it here, which is attached to the patella, and the patella, therefore, is a sesamoid bone in the tendon of this muscle because it is going to attach by another ligament, which is called the patellar ligament. It's going to attach to the tuberosity of the tibia. So, in fact, the muscle is attached by patellar ligament to the tuberosity of the tibia and cross the knee joint and act as extensors of the knee joint. But there's only one muscle, one member of this muscle, one part of this muscle, which is the rectus femoris, that is attached to the ilium proximal to the hip. So it can also act as a flexor of the hip. But the remaining muscle, most of the muscle, is only extensor of the knee. The other muscle in the anterior compartment is a long, slender muscle with parallel fascicles of muscle fibers. We have mentioned that in the beginning. That's called sartorius muscle. It arises from the ilium and is attached to the tibia on the medial side of the tibia, upper medial side of the tibia. So this muscle crosses, in fact, two joints. So it acts on the hip and it acts on the knee. The name of the muscle indicates the position that is acquired by using this muscle. And this is the cross-legged position that is acquired by old tailors. A tailor is a sartor, so the muscle is the tailor's muscle. Sartorius is the tailor's muscle. It allows the tailors in attaining the cross-legged position, which requires flexion of both hip and knee, as well as lateral rotation at the hip. This is the exact function of the muscle. Also, the muscle, because it is elongated and strap-like muscle that has an oblique extent, so it looks like a sash as it extends from the lateral side of the thigh to the medial side of the upper part of the leg. Muscles of the back of the thigh are called, collectively they are called the hamstring muscles, and they all arise from the ischial tuberosity. So the adductor muscles, they arise from the pubis, These hamstring muscles, they arise from the ischium, and to be specific, the ischial tuberosity, the bone that we sit on. And they are inserted into the proximal side of the leg. So we have one of these muscles here on the lateral side, which is called the biceps femoris muscle. Again, it's called biceps because it has two heads, long head and short head. In fact, the short head is only attached to the femur, but the long head, since it is longer, so it arises more proximally from the ischial tuberosity. The two heads unite to form a tendon that passes to be attached to the lateral side of the knee, so it's attached to the fibula, and therefore this muscle can act on both joints, so it can extend the hip, but at the same time it flexes the knee and laterally rotates the flexed knee since it's attached to the lateral side of the knee. The two other muscles, their names indicate the shape of the muscle. So the deep one, most of the muscle is like a membrane, a very thin tendon that looks like a membrane. So that's why it's called semimembranosus. That's the deep one. And then the more superficial one, which has a long tendon, rounded tendon, is called the semitendinosus. Both of them, semitendinosus and semimembranosus, they are attached to the upper part of the tibia on the medial side of the knee. And so, again, they extend the hip, they flex the knee, like the biceps femoris, but unlike the biceps femoris, which is attached on the lateral side, these muscles are attached to the medial side of the knee, and therefore they rotate the flexed knee. They rotate it medially. They rotate the flexed knee medially. In the anterior crural compartment, anterior muscles that are located in the leg, we have multiple muscles, but one of them is called tibialis anterior, and as the name indicates, it's attached to the anterior part of the tibia and has a long tendon that is attached to the medial side of the foot. Therefore, when this muscle contracts, it dorsiflexes the ankle, and at the same time, because it's attached to the medial side of the foot, therefore it can invert the foot. These muscles are in a very tight compartment, and so when their tendons are inflamed, therefore they result in pain called shin splints. In the lateral compartment of the leg has three compartments, has anterior, lateral, and posterior. So in the lateral compartment of the leg, therefore, the muscles are attached to the fibula and are called fibularis muscles, two muscles. One of them is called fibularis longus, and the other is called fibularis brevis. And you can see here that the fibularis longus will go again, it will be attached to the foot and passes behind the ankle joint. So that's why this muscle plantar flexes, because it passes behind the ankle. Unlike tibialis anterior, which passes in the front of the ankle, this muscle passes behind the ankle, so it plantar flexes the ankle, as well as because it comes from the lateral side, so it everts the sole of the foot. Muscles in the posterior crural compartment, we have the most superficial muscle, is called gastrocnemius. Gaster means belly, so because this muscle forms the prominence of the calf, so it's the belly of the calf and has two heads that arise from the femur. So that's why this muscle also acts on the knee joint. It flexes the knee. But mainly, this muscle is going to form a big tendon behind the ankle, which is called the calcaneal tendon because it's attached to the calcaneus, the bone that we stand on, the bone of the heel, called the calcaneal tendon, and passes behind the ankle joint. Therefore, it plantar flexes the ankle. So in addition to flexing the knee, it also plantar flexes the ankle, and this joint and this tendon, the calcaneal tendon, has another name. It's called the Achilles tendon. Achilles is the Greek hero who was dipped by his mother when he was young. When he was a baby, he was dipped in a river so that to make his body invulnerable to arrows or swords. But unfortunately, when his mother dipped him, all his body was wet except the region around his ankle, and that's why it remained dry, and that's why it remained vulnerable, and he was hit by an arrow in the Achilles tendon, which caused his death. That is in Greek mythology. The posterior crural compartment has another muscle here, which is called the soleus. This is a very strong muscle. It's attached to the tibia and fibula. It's not attached to the femur, so it doesn't act on the knee, unlike the gastrocnemius. But like the gastrocnemius, it's attached to the same calcaneal tendon, Achilles tendon, and so it acts on the ankle joint. It's plantar flexus the ankle joint. The name of the muscle might indicate that it's a muscle that is present in the sole, but the muscle is present in the calf and was called soleus because the shape of the muscle looks like a solefish. This is the last slide is to review the surface anatomy, and you will find similar slides of surface anatomy are also present in the self-assessment lab questions. Thank you.